Member for Thunder Bay, Superior North.
Mr. Speaker. Mr. Speaker, we Canadians are getting older. The percentage of Canada's population over 65 has nearly doubled since the early 70s. As our population ages, the strains on our healthcare system are continuing to grow. Dealing with this situation will not be easy. In a response to my question, the Secretary to the Minister of Health spoke about innovation. Innovation is exactly what Canada's healthcare system needs, but it's not what we're getting from the Conservatives. The Conservative approach to dealing with Canada's health problems has been to evade and download the issue onto the provinces and pray that costs will somehow get better. They refuse to plan ahead. In Thunder Bay Superior North, our seniors are being stacked up in temporary cots in hospital hallways due to a lack of beds. Our system is overburdened by inadequate federal funding and a total lack of long-term planning. We're the only country in the G20 with no national health care strategy. As Canada's population gets older, our health care woes are only going to get worse if we don't start making some serious plans and taking action. We must invest in long-term solutions for our health care system. Continuing care is now incredibly excluded from the Canada Health Act, if you can imagine. By contrast, Nordic and European countries have long-standing public, comprehensive, universal, and tax-financed continuing care programs. Chronic disease management programs require a multidisciplinary approach designed to encourage adherence to medications and lifestyle changes and promote prevention and patient self-management. Such programs can reduce complications, avoid costly readmissions to the hospital, and improve survival and quality of life. Our federal government needs to stop forcing those who do need long-term care onto emergency facilities that weren't designed and aren't equipped to deal with their needs. Up to 90% of seniors deal with at least one chronic disease. Treating those diseases amounts to 67%, two-thirds of all health care costs. On any given day, patients approved for hospital discharge who can't access appropriate post-hospital care occupy about 7,500 beds across Canada. This government needs to develop a national health care strategy with a focus on dealing with chronic diseases through investment in preventative, long-term, and home care. There's a huge shortage of long-term care facilities in Canada, and as we get older, demand is only going to go up. Many provincial governments have recognized the need for these facilities and have begun investing in them. The Conservative federal government needs to step up and join them. Investing in home-based care is a very practical strategy. An astonishing 13 million Canadians already provide some kind of home-based care to their own family members or friends with long-term illnesses. 96% of Canadians support public policy changes that would allow seniors to age in their homes while receiving effective home-based care by professionals. The Canadian Nurses Association, as well as numerous healthcare experts from across Canada, have advocated heavily for long-term and home-based care. Every time someone can't find a room at a long-term care facility and is forced to go into a hospital, they're costing taxpayers. A hospital bed costs the taxpayer 6 times what a long-term care bed costs and around 20 times what home care costs. When will this government listen to the experts and invest in long-term care strategies that work and dramatically lower costs in the long run? Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary to the Minister of Aboriginal Affairs.
Well, thank you, Mr. Speaker. I'm pleased to address the honourable member's comments regarding the performance of Canada's healthcare system in the face of an ageing population and changing healthcare needs. Our government is committed to a publicly funded, universally accessible healthcare system. While provinces and territories have primary responsibility for delivering healthcare federally, we will continue to provide significant support through fiscal transfers as well as targeted initiatives to foster improvement in critical areas. Since taking office, our government has increased the Canada Health Transfer by almost 70%. Federal health transfers to provinces and territories are at an all-time high. on track to increase from $34 billion in 2015-2016 to more than $40 billion annually by the end of the decade. This represents a record investment that provides the provinces and territories with the financial predictability and flexibility to respond to priorities and pressures in their respective jurisdictions. For example, this funding enables them to further develop their own home care and long-term care programs and services to respond to the unique needs of their senior populations. Mr. Speaker, our government is committed to the health, well-being and quality of life of Canada's seniors and recognizes the importance of home care and long-term care as an effective means of delivering the type of care required while reducing unnecessary pressure on hospitals. We recognize that many older adults would prefer to remain in their own homes for as long as possible. That is why Budget 2013 announced expanded tax relief for home care, including services such as bathing, feeding, and other personal care. However, we also know that money alone is not going to enable our healthcare system to address the complex challenges posed by an aging population, increasing rates of chronic disease, and slower economic growth. We know it is also important to explore innovation so that Canada's healthcare system can adapt to this new reality, continuing to provide the quality care that Canadians expect over the long term. Mr. Speaker, the Government of Canada is the single largest investor in healthcare innovation, with more than $1 billion invested annually to support health research, knowledge development, and positive change. For example, through Budget 2015, we will enhance our ongoing support of Canada's Strategy for Patient-Oriented Research, or SPORE, increasing our investment by $13 million to the Canadian Institutes of Health Research to expand this initiative. SPORE aims to align research, innovation, and health systems to ensure that patients receive the right treatment at the right time. Looking forward, we are committed to working with provinces, territories, and stakeholders to strengthen Canada's healthcare system for all generations through research and innovation.
The honourable member for Thunder Bay, Superior North.
Mr. Speaker, our hospitals are not intended or well equipped to deal with preventing and treating chronic diseases. This government's lack of planning is forcing us to ship our seniors off to overcrowded and expensive emergency care facilities instead of providing them with appropriate long-term care. We must invest in long-term care and home-based care for seniors in Thunder Bay, Superior North, and across Canada, partly in order to free up acute care beds in the Thunder Bay Regional Health Science Centre. Investing now will save the taxpayers millions in the long run, billions actually. If this government truly believes in innovative policy, then when will it start investing in it? The feds and the provinces used to each pay 50% for health care costs. Today, the federal share is less than 1/2 of that. Mr. Speaker, when will we see some adequate funding? And, Mr. Speaker, when will we see some real evidence-based health care policies for Canada? Thank you, Mr. Speaker.
Honourable Parliamentary Secretary.
Mr. Speaker, I'd be happy to expand on our government's commitment to innovation in long-term care and preventative health care. One example is Economic Action Plan 2012 provided $6.5 million over 3 years for a research project at McMaster University to explore how the use of technology in primary health care can improve continuity and cost-effectiveness of care, particularly for at-risk seniors. In Budget 2013, we also announced $3 million in funding to the Pallium Foundation of Canada to support training in palliative care to frontline healthcare providers. To summarize, our government is committed to Canada's system of publicly funded health care and improving care to seniors. We placed health transfers on a sustainable and predictable growth path, and we will continue our investments in research and innovation in partnership with the provinces, territories, and stakeholders. Thank you, Mr. Speaker.